Hey, we are now presenting how to cure vaginal infections without using medications. Number 1. Recognize the symptoms of BV. Bacterial vaginosis is typically marked by certain symptoms. These include vaginal discharge with an unpleasant odor, often described as fishy. Vaginal discharge that is white or gray and may look foamy. Burning on urination. Itchiness and irritation around the vagina. Keep in mind that not all women with BV have symptoms. Number 2. Recognize the symptoms of a yeast infection. Yeast infection symptoms can often resemble the symptoms of BV. These symptoms include an abnormal vaginal discharge. The discharge can be a watery, white discharge to a thick, white, and chunky discharge. This is often described as looking like cottage cheese. Itching and burning of the vagina and labia. Painful intercourse. Painful urination. Redness and swelling of the area just outside of the vagina. Number 3. Recognize the symptoms of trichomoniasis. Symptoms of trichomoniasis, sometimes called trich, in women can be vaginal discharge that is usually smelly or itchy. Vaginal discharge that is typically frothy or foamy. Vaginal itching. Yellow or a gray-green discharge. Painful urination. Number 4. Keep track of your menstrual cycle. Vaginal infection symptoms can differ depending on where a woman is in her cycle. This is because the hormonal changes during the menstrual cycle can affect the composition of the bacteria in the vagina and the characteristics of the vaginal environment. Knowing your menstrual cycle will help you keep track of changes that you are experiencing. Number 5. Realize that some women experience no symptoms. Many women have BV or trichomoniasis, but they do not have any of the telltale symptoms. If you suspect you might have an infection, see your doctor. Trichomoniasis can be transmitted to sexual partners. If you suspect you have trich, see your doctor for a diagnosis and treatment. Number 6. Know that the risk of BV increases with certain activities. Most women have probably had at least one experience with BV. There is no specific cause. Essentially anything that disrupts the normal bacterial balance in the vagina can result in BV. The risk of BV increases with having a new sexual partner, having multiple sexual partners, having sex without a condom, douching, using an intrauterine device, IUD, as a method of birth control. Number 7. Know what increases the risk of yeast infections. Yeast infections, also called candidiasis, are increased by wearing tight underwear or non-cotton panties. These styles of panties can increase the temperature, the moisture levels, and can be irritating. A weakened immune system. Using vaginal douches and or perfumed feminine hygiene sprays. Vaginal trauma. This can be scratches in the vagina that occur during insertion of a tampon or other objects, or during rough sex. Thanks for watching. Please like and share this video. Don't forget to subscribe our channel.